Finally tonight, after doctors do a biopsy on a tumor in the intestines, it sometimes takes a couple of weeks for the diagnosis of benign tumor or cancer.
Well, now there's a technology that is so advanced, it's space age. Senior medical reporter Dr. Jay Adlersberg is here with more. Jay?
Diana, that's no exaggeration. The guy who invented this device formerly worked at NASA. It's a microscope the size of a grain of rice. It allows doctors to diagnose an abnormal lump in the intestine or esophagus and treat it right then and there. If the word microscope brings this image to mind, you might be surprised that the silver tip of this fiber optic wire does exactly the same thing. It magnifies what it sees by 1,000 times. Irene Knapp was lucky it was around when her doctor found a growth in her esophagus, a precancerous growth.
Precancerous, it's a little scary when you hear those words. It looked precancerous, so we decided that it had to be referred to the specialist.
To Dr. Stavros Stavropoulos, who looks into the stomach and esophagus on a bunch of patients, but the tiny microscope has made things simpler and easier for Irene.
This tiny microscope allows you to better assess the extent and stage of these lesions by getting an immediate pathologic diagnosis right there at the bedside.
Normally, pathologists prepare biopsies from precancers and look at them under the microscope. It can take a week or more for the diagnosis. Now, Dr. Stavropoulos can simply thread the tiny device through the endoscope in the patient's esophagus. It comes out next to the precancer. Once doctors thread the microscope into the intestine, they press the tip up against the intestinal wall to see the microscopic pictures, which showed not precancerous cells, but actual cancer cells. Dr. Stavropoulos was able to remove them completely through the scope. Irene was diagnosed and operated on all in 4 hours instead of several weeks.
Right then and there, he would know, and he could save my life and give me many more years. I was very fortunate. I really feel I owe him a lot.
The microscope was also used to diagnose and treat precancerous colon polyps and problems in the pancreas and biliary ducts. Irene improved so quickly from the esophageal cancer removal that a couple of months later she had open heart surgery.
Wow.
And had a normal recovery from it. Diana.